I am going to kick us off here, and we may have some more folks joining, but I think we're on time, and so we'll go ahead and get started. So, welcome. My name is Elizabeth Nielson, and I'm the co-founder of Fluence. I'm a psychologist, and I have a background in clinical research with psychedelics, as well as leading this program, which is all about education and training and helping clinicians get welcomed to the field of psychedelics all the way through doing all the professional training they need to become professionals in the field, as well as to sometimes work on research studies and things like that. So we have a really wide variety of programming. I know some of you here watching actually are part of our organization. We've got some trainers in the audience. We've also got some people who have attended a number of our programs, and probably some people who are new to us. So if you're interested in finding out more, please check out our website, check the links in our follow-up emails, and join us for, for some additional programming. The webinar series is something that we host about once a month. And we like to have a variety of different guests and speakers and really give you more of a personal conversation and more of a perspective from someone working in the field, somebody who's got some experience, but also is able to give you a variety of perspectives on things that are going on in the field currently. So we've run a really wide variety of topics, and there is an archive of webinars available on our website. If you're interested in signing up for that, you can get access. But I'm really excited to be here today with Dr. Kelly Sykes, because Kelly was somebody who started attending a Fluence program. I think it was back in 2020 when we were just barely starting to do things online, and everybody was switching from in-person events to online events because of pandemic. And we really heard in Kelly's voice some just incredibly thoughtful perspectives about the links between psychedelics and mental health and healing and psychotherapy. And Kelly really has a very strong background in psychodynamic psychotherapy and psychoanalysis. So we were really intrigued actually when we met her in a course, an online program. And so we asked if she would be interested in working some more with us and creating some more programming. And we've done that over the years, and Kelly's been a really important part of our organization. So I'm very excited to have this conversation, and I will let Kelly tell you more about her background. But today's focus really is going to be on the concept of attachment and how attachment comes into play in psychedelic therapies, psychedelic treatments, really broadly defined. So attachment is a fascinating topic. If it's a new topic for you, Kelly's going to give enough background that you'll be able to catch on to the basic concepts and understand how they relate to what we're talking about with psychedelic therapy. And maybe it'll spark your curiosity to go on and do some more exploration in psychodynamic theory, or learn more about the link between attachment and healing and how psychedelics might play into that. So without further delay, I will ask Kelly to take the lead and introduce herself.
Hi, thank you so much for inviting me. I'm very excited to have this conversation with everyone today, even if it's by chat. So my training is in my initial training was in child clinical psychology, and then I transitioned into child forensics or family forensics, which essentially means that I'm working with court-involved families and parents and their children. So they have come to the attention of the court through a variety of means, through divorce or custody, through juvenile delinquency, possibly it could be an immigration case, it could be a child protection case. But in every type of role that I play with each family, I have to kind of understand a bit about the story of the family or the story of the parents. So storytelling, how a person constructs their life, becomes a very important part of the beginning of how I start a forensic evaluation. So in the beginning, I ask very open-ended, broad stroke questions because I want to get a sense of how people kind of format and organize their life in a way that explains what were the important events, who were the important people, and how well sequenced are they able to give this story. It's a huge organizational task to ask people to kind of format and give this kind of broad view of their lives. And so one of the things that I listen for and what helps me through my training in attachment theory is kind of hearing the coherency of how they construct a story and how they utilize me in the construction of that story. So just very, very simply, is a person being vague because they're trying to invite me into some kind of involvement or chase with them, where it's kind of a provocation? Is a person being vague because they don't necessarily have access to their feelings or insights about a particular scenario they might be describing? So, and what do they do? How do they use me? Do they want me to help them excavate this story? Do they want me to be kind of distanced in how they explain this so that there's no room or role for me to enter into the story? So this all becomes very interesting in terms of understanding how a person constructs the major events of their life to the point where they can explain or give their understanding of why they're in my office right here today. How well do they do that? So when we think about attachment theory, and I'm trying to understand relationships, attachment theory, how we relate to people is built on our memory systems. And so we make predictions about what to expect from other people in terms of comfort or protection based on what we've learned. And so what I'm going to do is I'm going to go through the 5 memory systems with the aim of looking at these memory systems through attachment theory, and then give an example to kind of really hone in on how we think about the memory systems and how that frames how we listen to how a person might construct a story about their life. So just broadly speaking, should I start with the talking about the memory systems? Are you ready for that?
Yeah, I think that would be great, Kelly. And I appreciate just sort of the context of where you're coming from. I just do want to remind folks that if we are going to do Q&A towards the end. So if you have questions coming up for you while you're listening to to Kelly's presentation, please use the Q&A function in Zoom. It'll help us be able to find your questions later. And we'll make note of those, and we're going to try to get to as many of them as we can.
Okay, so let's just do a kind of a very quick and broad understanding of the memory systems. So we know that there are 2 broad categories of our memory systems, the implicit and the explicit. And the implicit memory system are our automatic memories, our automatic understanding of how the world functions. It's pre-verbal, it's pre-conscious, and it's our earliest understanding of the world and our caregivers. So that first memory under implicit is your procedural memory. And the procedural memory is your understanding of how things are ordered. So infants have their first memory is procedural. So what happens when they cry becomes the first procedural memory that starts to develop. When they cry, do they receive care, neglect, danger? And that in turn changes what they do in response to what happens. So procedural memory is sort of the sequence of what happens. And then your next implicit memory is your imaged or sensory memory. So here again, infants have the capacity to see, hear, feel, use all of their senses as cueing information about what to expect. So your sense memory, your image memory is giving you more context about how to know what to expect. So if we think about if the infant sees the high chair being set up and sees food being brought out, those images cue the child to start mouthing because they know they're about to be fed. If an infant recognizes they don't have a understanding of the smell of alcohol, but they can associate the smell of alcohol with danger, and that might alter their behavior. So sense memory and image memory is very important in terms of cueing us about what to expect in terms of safety or danger. So we have our procedural memory, we have our image sensory memory, and these are our pre-verbal memories that are implicit. And then as we age, as we move into our toddler years and our verbal skills start to come online, we start to develop our explicit memories. These are our conscious memories. And our conscious memories, the important thing to understand about explicit memories, which starts with our semantic understanding of the world, is that those are co-constructed. It's the parent who's first explaining to you the cause and effect of why things happen. So the accuracy of how the parent is constructing meaning with you becomes very important. One of the things that comes up in my work is when kids might show fear or anxiety towards another parent. And so when you're talking about a 2 or 3-year-old, it really matters what a parent says in explaining, why a child might be showing certain kinds of behaviors. So if the parent says, you have butterflies in your stomach because you're scared to see your father. That creates one kind of semantic meaning. You have butterflies in your stomach because you're excited to see your father. That creates another semantic meaning. So the accuracy of the parent's construction of cause and effect becomes very important as those explicit memories start to come online. So they're first co-constructed with the parent, and then over time, they increasingly become your own information processing system. Okay, but your parents create that first template of how you understand meaning, how you understand cause and effect, and how you understand blame and responsibility. So you have your semantic memory, then you have your episodic memory, which is also coming online 2, 3, 4 years old. And episodic memory are those discrete stories that kind of string together to kind of tell you, to create your self story, your self narrative. And again, as those things are coming online, the people who are taking care of you are the first people to kind of help you shape how you understand the important events of your life. So a series of events, a series of episodic memories lead you to conclude that your parents were divorced, right? So episodic are very discrete memories that string together and create a self narrative. And the quality of a episodic memory, it should be very much located in a specific time and place. So the person recognizes that they are having a memory. They have some feeling about the memory. They know the major players that were a part of that memory, and they can temporally sequence that memory. There's some sense of a beginning, middle, and end. And they can identify some feelings about the memory. So these are kind of the components that kind of go into what constructs an episodic memory. But you can see that there would be that episodic memory, that the quality of it, of how much these different components are present or absent, is very much built on how much what the parents are saying are the important things to construct meaning around. And then you have your final memory, which is your integrative working memory. And that's the one I call that's the one that's sort of walking into the office, right? That's your how you put everything together, what you're predicting, what you would predict from other people in terms of what you expect to receive in terms of comfort or protection, how you understand yourself in relation to how things go well or don't go well. But it's your basic working understanding of yourself and your working way in which you're going to be making predictions about what to expect from others and what to expect from yourself. And that's your final memory. So I think it really helps to look at these memory systems and how we're listening for them through an example. Okay, so I'm going to just share screen for you for 1 second. I'm going to okay, so we would never just use one question from any kind of interview to kind of make diagnoses or draw conclusions. So we're just using this as an example to kind of highlight some of the memory systems and to kind of use this as a jumping point to talk more about how psychedelics might factor into this. So one of the early questions in the adult attachment interview is a question about asking the person to give their earliest memory. So I'm going to go through a sample from, it's anonymized in terms of changing some of the details, but this is to give you an example of a response I got from this question. The interviewer, what is your earliest memory? Tell me everything you remember, David. Oh yeah, this is a funny one. I remember being on the steps. Maybe I was at the top of the steps, and I think I must have fell down the stairs because the next thing I know, the next thing I know is that there's blood everywhere. Get this, I knocked out my front teeth. Can you breathe? Is crazy, right? Who was there when that happened? Probably mom. She was a stay-at-home mother. Why do you think that memory stands out for you? I was super clumsy. I was the super clumsy kid in the family. I really gave my parents a run for their money. I just never paid attention, you know? They used to call it accident prone. It seems like every week my parents were taking me to the ER. This was way before urgent care existed. So going to the ER was an all-day affair. And how old were you when this happened? Well, obviously I have my front teeth. So it must have been my baby teeth. When do your baby teeth grow in? I should know this because my daughter is 5 and she started to lose her front teeth. Okay. So let's look at this. Let's look at this through the memory systems. Okay, so if we're going to go through this and talk about our implicit memory, and we're talking about procedural memory as your first cause and effect understanding of what to expect from others in terms of protection or comfort. It's the automatic. So if we were going to ask, what the procedural memory here, what does David automatically do in response to pain? And this you can put in the chat. This is procedural memory. This is what's automatic. What happens when the baby cries? So what does David automatically do? Are we getting some answers in the chat? I'm sorry, I can't see the chat.
Yeah, I'll read it off for you. We got a couple answers. He laughs, he minimizes, blames himself, uses humor as a defense, withdraws.
That's right. It's automatic. It's an automatic, how aware is he that he's actually automatically setting up something that sounds to the listener like would be a painful experience. He automatically sets it up, flags to the listener, nothing serious here. This is a funny one. So let's go to imaged, the next memory. This is the implicit. These are the automatic, the preconscious. What information does the sight of blood give David about whether he will receive comfort or protection? So your imaged memory is cueing you and alerting you around what to expect. What's the context in which you're going to get, what cues, what's going to bring protection, what's going to bring comfort or not. So what information does the sight of blood give David about whether he'll receive comfort or protection? Elizabeth, if you want to read off some of the answers, that would
Yeah.
be.
Well, one notices, let's see, that mom was there, but it sounded like she didn't do anything, that there's dismissiveness, taking him to the ER, but not any emotional comfort. Him feeling like he's creating a big ordeal because he has to go to the emergency room. And let's see.
So
Sounds
what
like
so what you're noticing is that the blood doesn't give you a clear, doesn't clearly bring protection, right? That's what's being highlighted in some of that, is that in his construction, in his first round of telling the memory, before I ask any questions, um, the sight of blood doesn't give you any information about where's the caregiver, where's protection coming from. So in his first telling of it, what's also missing in the sensory information, because sensory is also, it's all your feel, your touch, sight, sound, smell, pain. So
Mhm.
what's missing in his first round of describing this before I even ask questions?
Yeah, people are noticing that there's no mention of fear or pain. Uh,
Exactly.
there's no
Right.
emotional response,
Right.
and
That's right. So
there's no
already
comfort.
we have in his implicit, right, in the part that's least conscious, we see some things happening automatically, right? That lack of pain, lack of fear, in response to something that theoretically should normally elicit fear, normally elicit pain, right? So pain, so those kinds of feelings that will give you information about what to expect or what to do, it's not in that first telling of it. So the absence, the omission of pain becomes very important. But you see that something about what's happening with the caregivers um, leads him to automatically not see his own pain. Something about what happens when we go back to that example, what happens when the infant cries? Do they get comfort? Do they get protection? Does their danger increase? Does their distress decrease? Does that change what they do the next time that they cry or not, to maximize getting care from that person? All right, so let's go to the next point. Let's go to the explicit part of this, the part that is now in his conscious mind. The semantic memory. What is David's general understanding about himself? What is his semantic takeaway?
That he's clumsy, that he's accident prone, that it's his fault.
Whose perspective do you think it represents?
That he causes his parents problems. His parents'
Yeah.
perspective. Yeah, somebody
Yes.
else's perspective.
So if we think about that semantic memory, that co-construction, that meaning that parents are the first to fill in that cause and effect, right? This is, and that when your verbal skills are coming online and how you're constructing meaning is coming online, how much access do you have to that as an adult? And so when you are, you know, giving these descriptions of yourself as an adult, how accurate, I mean, you have sometimes the question is, is it accurate? You know, how would you know if it's accurate in some ways? Really depends on how accurate your parents were. And then whether or not you were able to separate yourself from their construction of you to develop your own self-construction that might be separate from them. But you can see how early on that these ideas about oneself starts with the parents' construction. So somehow his parents are conveying very early on in his earliest memory that somehow he is at fault for anything that happens.
Mm-hmm.
So let's look at the episodic. If we're thinking about the quality of that memory. So do we get a clear temporal sequence? Can we get a clear beginning, middle, and end? You know, when we're thinking about the quality of of the telling of it, can you kind of imagine it in terms of how it began and where it ended? I'm just going to ask some other questions. Do you get some other things that can you get a sense of his age? Who was present when we think about the first telling before the interviewer has to ask questions about that? You know, who's present? Who are the relevant people in this memory? Do you know the relevant people in this memory? Do you know what his feelings are?
Mm-hmm.
Is it clearly located at a specific time? And is it clearly ordered in a way that's understandable? So when you're thinking about how the person is recalling a memory, that's one of the ways you're thinking about, is there blind spots? Is there trauma somewhere that's causing this to be a very disordered, mangled, confusing memory? Do you, as the person hearing it, have to do a lot of excavation to kind of make sense of what's happening? Is the person talking about it as if it's happening now? It's not clearly located as a memory in the past, but they're mixing the past and present. So these are the things that kind of can help you understand when you're hearing a person telling something. Does it lack these attributes, or does it have these attributes?
Yeah, we've
What
got
are
some answers here. That he's unsure about the time and place. There's no real time and place. It's in the middle. There's a middle. There's no beginning or end. the players are missing. There's no sense of who is in the story.
Yes.
And he says, I remember being on steps, but not any particular steps. Is this at home? Is it outdoors? Is it indoors? Like there's not a lot of context. Is front steps? Is it, basement steps? We don't know. Um, and he's making a lot of assumptions that the provider is following his story. So he's not, it doesn't, I think that means that, and I noticed this too, he's not really checking with the interviewer to get acknowledgement, or are you following, or am I communicating in a way that is heard? It's just putting it out there and not really making sure that the information has been conveyed.
That is such an important thing that I think about is when you're talking about an organizational task, they're organizing it for the listener. And so how aware are they of whether or not they are conveying what they want to convey? So for example, are they saying, I realize it's weird. I can't quite remember when this happened. So they're already letting you know that, oh, that there are components of this that I can't quite piece together. So there is some awareness that they realize that there's something missing from it, so that the listener might not be able to follow. So that's a very important thing to consider, is because it is trying to ensure that the listener is understanding, and where do they lose the listener, and are they aware of it? That's a great point. Let's go to the last one, which is what I consider, that's the person walking into the room. That's your the integrative working memory, the one that's the one that's operating all the time, making predictions all the time in the present about what to expect from the self, from the other, the one that's making ascribing blame and responsibility. And so this is the person's most conscious sense of self, and it's built on the least conscious aspects of their memory. So the quality of it becomes, their information processing capacity becomes very important. So let's talk about this in terms of David. So David's walking into your office. Who is David most likely to blame for any failures in his life? Does he believe he can prevent bad things from happening to him?
Mm-hmm.
And who does he turn to when he's in pain, or how aware is he of his pain?
So he's most likely to blame himself when bad things happen. And he may not really be aware of the pain that he's in, or he may just blame himself and not really expect much comfort or care from others.
Yes. Yeah. But does he believe does he believe he doesn't expect much care or comfort for others, but does he believe that that's right and fair? Does he have a right to comfort and care?
No, because he's accident prone. He doesn't really believe he has a right to comfort and care. From his perspective, it's not something he has a right to. So yeah, I think our audience is pretty much in agreement here that he doesn't feel that he has a right to being cared for or being comforted. It's just something that he may not be deserving of because he's disruptive.
Yeah, so when I think about this, this is sort of the jumping point from, the clinical therapeutic ongoing therapy work with this person versus where psychedelics can can operate with this person. Because the thing that I wonder about, and part of what my experience has been, is that you're speaking to their most conscious sense of self, but you might be asking them about, neglectful caregivers, but their capacity to understand and hear that, there might be a mismatch because it becomes such a procedural early memory of who's responsible, um, who's to blame, that trying to speak to that person or try to offer empathy to the person who might not have been cared for, that might be a mismatch. They might have a hard time hearing that. And so I wonder about, and this is where I want the kind of the discussion to go. I wonder about the memory systems and that implicit memory, and how the psychedelics might be able to work on those implicit parts of the self, that are so automatic and so difficult to access in a conscious, talking way, I think sometimes. I'm going to stop share here.
Yeah, well, it's a really interesting question, Kelly, and I think this is like sort of the crux of this discussion. And what I'm observing is that there's a lot of focus. There can be a lot of focus in our field among some clinicians in this sort of idea of the mystical experience, and that being the mechanism of action or the reason for that's driving a lot of change in psychedelic work. But what I've noticed as a clinician working on clinical trials has been that a lot of people will have what we call more of an autobiographical experience.
Mhm.
So there may be a psilocybin experience or on MDMA or something where they're really sort of rethinking and reprocessing and re-understanding or reorienting to some of these early memories that could be very vivid for them, very easy or more easy to recall, maybe less frightening to recall in that moment because of the euphoric effects or the mood enhancement, those sorts of things. But I wonder if, just for us as therapists and clinicians, having an understanding of these memory systems can help us understand how it could be helpful for someone to reaccess and sort of reassess these early memories in this different state of consciousness. Because first of all, these things are usually so far like out of our awareness on in our normal waking consciousness, right? This is stuff that's just sort of affecting us in the background. Um, and that can actually be a really important way in which these experiences can be helpful and could be attended to, you know.
Mhm. Yeah, yeah, let's see what people are saying.
Mm-hmm. Yeah.
All right, I can't seem to access the chat.
So someone's asking about the function of memory reconsolidation in this context. Reviewing memories, reaccessing them, maybe seeing them in a new way during these experiences.
Yeah, so when we're talking about, so now when I think about reorganizing, now it makes me wonder, are we reorganizing those automatic implicit aspects of the self? Because if you change your prediction model at the top, have you actually changed all those other memory systems in some substantial way as well, so that your automatic, your default strategies have been disrupted in some way, so that you don't automatically assume it's your fault.
Mm-hmm.
So does that mean that you have in some way reorganized those implicit parts of the self or parts of the memory?
I mean, I would think so. I think a lot of the sort of cognitive therapies or talk therapies, we're often talking about noticing thoughts, noticing assumptions, noticing automatic thoughts and changing them, but we don't really have another tool for getting at those very early implicit memories that are driving those patterns in the first place. So we're trying to change them from sort of a top-down, like maybe a little heavy-handed way. And that, when people come in and they have more of an autobiographical experience during a psychedelic state, perhaps they're sort of rewriting things from a different angle, and then the experience is understood differently, and that may just simply result in different patterns of approaching relationships or understanding what's going on around you in the daily life. But it doesn't feel as though you're sort of trying to hack into it from that more top-down perspective. And I don't know if that's aligned with other folks' experience, but I think this really points to the importance of those autobiographical experiences and how they can be reflective of this therapeutic process as well.
Mm-hmm. Yeah, it's not an intellectual change, it's a lived, embodied change.
Mm-hmm.
Yeah.
Yeah.
Looking at
Also think this is I'm reading a note from someone in the chat who's another trainer at Fluence, is talking about being interested in early trauma and disorganized attachment. And wait a minute, I lost that comment. Here it is. And how psychedelic therapy can offer patients reparative attachment experiences. And I wonder, if maybe you can speak to that a little bit, because I think psychotherapy, part of what it can do is offer a reparative attachment experience through the relationship with the therapist. But in a psychedelic therapy, you've got this even more intensified relationship. Often, you're with a person during this very intense experience. What's your sense of how that attachment relationship can be, that model attachment relationship could be shifted, maybe differently because it's a psychedelic therapy versus a non-drug or non-ordinary state of consciousness therapy?
Yeah, in forensics, the concept of disorganized attachment has a bit of a controversy around it. And I think it speaks to this person's question in the sense that, so first of all, we think in terms of attachment strategies as maximizing a person's survival. So the one way in which disorganized attachment is understood is that the child couldn't get a working, predictable understanding of what to expect from the parent. And so they operate in an unpredictable, disorganized way with other people in their other relationships. And so there's always this feeling of not being able to feel like you are in this reciprocal, predictable relationship in the adult sense. But another way to understand an attachment strategy is that you're looking at the person through the adult lens, but that something that they were doing in that attachment relationship was eliciting, either comfort or protection because it enabled their survival. One of the things I always try to bear in mind is that if a person is in your office telling their story, they did something, they developed some kind of strategies that enabled their adaptation. And so what helped them adapt within the family might be maladaptive outside of the family. And so when we're talking about disorganized, we're actually, I think, labeling dysfunction when actually what we should be trying to understand a little bit more about what was the function of what was happening in the home, and then what's the function of this in your relationships out in the world. So it's this idea of helping to explain to the person a little bit, give them some education about how you adaptive strategies in families versus maladaptive strategies out in the world. because you are affirming their capacity to have survived and adapted under extreme circumstances, and now you're trying to help them adapt under less extreme circumstances, to read the room better, to know that they're not always having to adapt and respond to danger. So when we're talking about repair, I think a big part of that is affirming that there is adaptation in one area of your life, and let's figure out how we can um, um, use those survival skills and leverage them for adaptation in this other part of your life.
Yeah, that makes a lot of sense. Almost like attachment being, or what we might have referred to as a disorganized attachment style, actually being more like an overused defense that was helpful in a certain situation, but has now become sort of generalized in a way that is not always appropriate to the situation at hand. Yeah. Yeah, that makes a lot of sense, really. For sure. Let's see what else we got in the questions. Um, are you aware, are you following or aware of, and there may be stuff that we're not aware of. There's so much going on in psychedelic therapy research these days from a variety of perspectives, but any studies that are looking at shifts and quantifying shifts in attachment style in the psychedelic research literature that we could speak to?
Yeah, not so that's the $1 million question. Not that I'm aware of yet. I think there's a natural inquiry into that, and I think that that we're probably somebody's going to take that up.
Mhm.
So right now everything is so individualized in terms of fields.
Yeah.
That feels like there's going to be a natural bridge between looking at before and after. Um, an attachment, whether people's attachment strategies can be quantifiably changed.
Yeah. Yeah. I think there's that's one of the sort of longer term outcome research questions that'll be really interesting to look at. And perhaps if there's an FDA approval of something like psilocybin or MDMA in the future, we'll have the opportunity to look at that. And probably something you'd have to look at, I'm guessing, across a large population with a variety of
Yeah.
therapeutic models, so that you're not just getting the effect of like they had therapy versus they didn't,
Yeah.
right?
Yes.
Because you're going to probably need a pretty large pool of that. Um,
Mhm.
I am just scanning for additional questions here. Kelly asked what if you could cite the adult attachment interview, and if that's something that is publicly available that you could share, just to look at the actual interview, not exactly the example you've got.
Yes.
I know that's
The
a
adult
very standard format for interviewing.
Yeah, the adult attachment interview is, it's published and freely available. It's the discourse analysis where that's where the training is at. And
Mhm.
so if you don't get the training in the discourse analysis, which really trains you to hear how people are responding to these answers through these memory systems, to kind of arrive at how they're functioning and how their relationships are functioning in the present day. So that discourse analysis is the core of understanding and utilizing the adult attachment interview. I did put in the organization that I did a lot of training from in the chat. Oh yes, there it is. The International Association. Um,
Okay.
so a lot of people don't know that there are two different versions of attachment theory, the two different major versions. Most people are exposed to the American model, which is the secure, insecure. That's actually the Berkeley model of attachment. And then I was trained in the dynamic maturation model of attachment, which uses protection and comfort as its organizing principle, not secure and insecure. And that's a very interesting background as to those differences. But so that when you're hearing me talking about what does the person do to elicit protection or comfort, and speaking in terms of strategies, that's coming from that particular model of attachment theory, which I prefer for a variety of reasons to the insecure, secure model of attachment theory. But that's another story.
That's a very good. That's a very good point, Kelly. I noticed the difference in that terminology, but it's really good to know where it comes from. So when someone in the audience decides to design a study of shifts in attachment style after psychedelic therapy, you'll know which model you might prefer to use to incorporate these measures into your work.
Yeah, exactly.
Yeah, really, really interesting. Thank you for that. That citation. Let's see. We've got time for a couple more. Here's an interesting question. What would you recommend to someone looking to shift their attachment style? What would you recommend them to ask for from a psychedelic therapist or guide? That's an interesting question. I know, are people aware when their attachment style might be something they want to shift or something that is causing them distress?
Well, see, that goes back to David. David would blame himself, right? So
Right.
the fault, you don't know if it's a faulty information system that's saying that I need to do it. Is the thing to do differently is how you evaluate blame and responsibility for what happens in a relationship.
Right.
And um, so when we're talking about I think that's one of the things that is difficult in understanding people's when they come into your office and they give you their story and they say, I need help. My relationships are always bad. I'm always screwing up my relationships. And we have no idea if that's if that self-attribution is accurate any more than the person who says that for some reason I just keep meeting these bad individuals. I don't know why. I'm a magnet for bad people, right? You have that kind of construction of self. I can't protect myself from these people who keep causing me problems. So as a starting point, one of the things as a question is your narrative even accurate? So it begs the question of what psychedelics would do in terms of helping the clinician, the client, answer that a bit, when you're coming in with a very clear idea about, blame and responsibility.
Yeah.
Um,
I do think that there is maybe this goes back to more mystical experience or mystical type experiences that happen, but I do think there's some underlying value in a common experience for folks of really feeling a sense of wholeness and completeness and not being at fault or not being the problem or the blamed one, not being inherently broken, if you will. And so for someone who may feel that, there's something inherently broken about them, that makes it very hard to shift and to change a pattern or a style that you might be just relating to the world from, because it's who you are. And so if that's something that can be opened up in a psychedelic experience, maybe people get a little more access to, as opposed to this is just who I am, a broken person that attracts bad people. Okay, now actually I'm a whole good person in an internal sense. Now there's something that's about my style, that's about how I'm relating to the world around me, a pattern, a memory, something is more accessible to be shifted because it's no longer who I am, right? It's
right.
something that could change. So and just speaking from sort of observations that again, there's opportunity to reevaluate some of those earlier memories through a different lens,
Yeah.
which can be very helpful. Yeah. If you were to say one thing, we're just about to wrap up, but if you were to say one thing that you might want therapists to keep in mind when they're having conversations with folks? Let's say just from a harm reduction perspective, someone comes into your office and they're just telling you about a psychedelic experience they had elsewhere. You're not giving them that treatment, you're not providing any more of it, but they're just telling you about it. From an attachment perspective, and from the perspective of understanding how psychedelics could shift attachment experiences, is there something you'd like clinicians to keep in mind when listening to people talk about those experiences?
Yeah, I think it would be sort of a similar idea in the sense of uh, uh, how is the memory of the psychedelic experience constructed in terms of the degree to which they felt nurtured or held, um, or the degree to which they could rely on themselves for comfort or support, um, uh, the degree to which the sensory information, because I do think that, you know, since people's omission, not paying attention to the right sensory information, either internally or externally, can cause a lot of uh, misfires and problems for people. So I'd also be wondering about how they're describing the sensory aspect. I think I'd be looking at sort of procedurally the cause and effect of things. How they did anything change in how they are ascribing, um, you know, cause and effect, anything about their imagery, um, and um, and then of course, did anything about their takeaway, their sort of self and other understanding? Did they hear anything change through that um, description?
Yeah. It's almost as though those, those same questions we would ask people about an early memory could be, you could use the same lens when listening to those psychedelic
Yeah.
experience stories.
Yeah.
Really, really fascinating, Kelly. I'm so grateful that you were willing to come and share this
Yeah.
material and your ideas and your thinking about this with us, because it's an incredibly rich conversation. It's thought-provoking, I think valuable for so many clinicians to hear. We hope you'll come back and do some do some more programming and teaching with us. I know we're all busy folks, but there's just so much value in your incorporating your ideas into everyone's thinking in this work. So we're at the end of our time for today. Thank you for being here. Thank you, everybody, for the audience, for sticking with us and answering questions and putting your ideas
Yeah.
in the chat. We hope to see you again soon. And everybody have a great rest of your day. All
Okay.
right.
All right. Thanks so much. It
Thanks,
was nice
everybody.
to talk. Bye
Thanks.
bye.
Bye.